Be good. Okay. Good afternoon, everybody. Thank you very much for joining Sir Patrick and Jonathan Van Tam in London and me here in isolation in Buckinghamshire. Today, we've reached the fourth step on our roadmap. And I know that with cases increasing steadily and with more and more people being asked to self-isolate, there will of course be those who would rather that we'd waited weeks or months longer and kept on social distancing and all the legal restrictions that we've been placing on our lives. And so I want to remind you all why I believe that it's right to take this step now, no matter how difficult it seems. And the logic remains the same. That if we don't open up now, then we face a risk of even tougher conditions in the colder months, when the virus has a natural advantage, and we lose that firebreak of the school holidays. And there comes a point after so many have been vaccinated, when further restrictions no longer prevent hospitalizations and deaths, but simply delay the inevitable. And so we have to ask ourselves the question, if not now, when? And though both deaths and hospitalizations, as I say, are sadly rising, these numbers are well within the margins of what our scientists predicted at the outset of the roadmap. And so it is right to proceed cautiously in the way that we are, but it's also right to recognize that this pandemic is far from over. And that's why I'm afraid it is essential to keep up the system of test, trace, and isolate. And I know how frustrating it is for all those who have been affected or pinged, and I want to explain, therefore, that people identified as contacts of cases are at least 5 times more likely to be infected than others. And even if they've been vaccinated, there is a significant risk that they can still pass the disease on. And so, as we go forward, I'm afraid that the continuing sacrifice of this large minority, those of us who are being asked to isolate, remains important to allow the rest of society to get back to something like normality. And I'm afraid that at this stage, it's simply a consequence of living with COVID and of opening up when cases are high in the way that we are. As you know, we'll be moving on August the 16th to a system of testing rather than isolation for those who are double vaccinated, by which time, of course, we hope that the wall of immunity in our country will be even higher. And in the meantime, I want to assure you that we will protect crucial services, including the staffing of our hospitals and our care homes, the supplies of food, water, electricity and medicines, the running of our trains, the protection of our borders, the defence of our realm, by making sure that a small number, very small number of named, fully vaccinated critical workers are able to leave their isolation solely for the work that I have described. But for the vast majority of us, myself included, we do need to stick with the system for now. And of course, the only reason that we're able to open up in this way at all is that we've vaccinated such a large proportion of the population and at such speed. It is phenomenal that every adult in this country has now been offered a first dose. But unfortunately, that does not mean that every person over 18 has yet had a first dose. So far, 96% of over 50s, 83% of 30 to 50-year-olds have taken up the offer in England, but there are still 35% of 18 to 30-year-olds, 3 million people, who are at the moment completely unvaccinated. And though we can all see the enthusiasm of millions of young people to get their jabs, we need even more young adults to receive a protection that is of immense benefit to your family and friends and to yourselves. And so I would remind everybody that some of life's most important pleasures and opportunities are likely to be increasingly dependent on vaccination. There are already countries that require you already to be double jabbed as a condition of quarantine-free travel, and I'm afraid that list seems likely to grow. And we're also concerned, as they are in other countries, by the continuing risk posed by nightclubs. I don't want to have to close nightclubs again, as they have elsewhere, but it does mean nightclubs need to do the socially responsible thing and make use of the NHS COVID pass, which shows proof of vaccination, a recent negative test, or natural immunity as a means of entry. As we said last week, we do reserve the right to mandate certification at any point if it's necessary to reduce transmission. And I should serve notice now that by the end of September, when all over 18s will have had their chance to be double jabbed, we're planning to make full vaccination the condition of entry to nightclubs and other venues where large crowds gather. Proof of a negative test will no longer be enough. Now, let me stress, we want people to be able to take back their freedoms as they can today. We want this country to be able to enjoy the fruits of our massive efforts and of our enormous vaccination campaign. But to do that, we must remain cautious and we must continue to get vaccinated. And that's why we're asking you to come forward and get your jabs now. Thank you all very much. I'll now ask Patrick to do the slides.
Thank you very much. Can I have the first slide, please? We have high levels of COVID and they are increasing. And this slide shows the number of people testing positive for COVID in the UK from the 1st of September through to now. And you can see the size of the autumn wave, then the winter wave, and then on the right-hand side of the slide where we are now. So whereas in the winter wave we were up to around 60,000 people testing positive per day, we are now somewhere up towards 50,000. So we're quite close to the size of the winter wave of infections, and this is going to increase. And step 4 is a big inside mixing step, so it will increase further as we go into step 4. The risks of high prevalence, high numbers of cases, are really 4 major risks. The first, of course, that translates to some extent through to hospitalizations and deaths, which I will talk about more. That's protected by the vaccine, but not completely. The second is, of course, there will be an increased risk of long-term complications, so-called long COVID. The third is that at high levels of infection, as the virus replicates, it makes mistakes, and those mistakes are what cause variants to occur. And the fourth is, because of high levels of infection, you have a high number of people who therefore pinged and off work, and it affects the workforce. So there are 4 strong reasons for worrying about high infection rates. And a fifth is that the testing process, of course, becomes very stretched at high levels of infection. So we have high levels of infection that are rising and will be expected to continue to rise. Next slide, please. When we look at the number of people in hospital with COVID, it's a somewhat different picture. So the first peak, second peak, you can see clearly, and then on the right-hand side, you can see that the number of people in hospital is increasing. So it will increase because of the infections, but not as far as it did before, and that is because of the protection of the vaccines. So we do expect this number to increase. We do expect there to be over 1,000 people per day being hospitalized with COVID because of the increased infections, but the rate should be lower than they have been previously because of the protective effects of vaccination and the real importance of making sure that everybody gets vaccinated. Next slide, please. If you look at the curves of death, then that's even lower, and you can see again the autumn wave and the winter wave with unfortunately large numbers of people who succumbed to COVID infection, and you can see in the dotted line the size of the first peak back to last year. We are seeing an increase in the number of deaths, but at a much, much lower level, but they again will continue to increase as infections increase, and will be expected to reach over 100, possibly a lot over 100, but we'll see an increase in deaths over the next few weeks as the infections rise, but at a much lower level again because of the protection of vaccination. Next slide, please. This tries to lay that out in a slightly different way. So the autumn wave is in orange and the current wave is in blue, and the curves have just been overlaid, and the axis that goes up is showing you the number of increasing cases or the number of increases in admissions or deaths, and along the bottom is the number of days since the start of the wave. And what you can see is a very close increase, overlap of cases increasing, very similar between the autumn wave and the current wave, and you can see the autumn wave then topped out at slightly lower levels. When you look at admissions, the number of admissions was higher in the autumn wave and went up sooner, and with deaths it went up sooner, is much steeper, and went to much higher levels than we're seeing now. So this again confirms the crucial importance of vaccination in protecting against the effects of the infection, as well as reducing amongst the population the chance of becoming infected. Next slide, please. Even with this more transmissible variant that we have now. In terms of the vaccination profile, the Prime Minister has mentioned this. A large number of people have been vaccinated. Something like 88% of the adult population has had one dose, and 68.5% have had two doses. So large numbers have been vaccinated, but of course it means that large numbers also have not been vaccinated. There's still people in their 20s and 30s who have not yet been vaccinated, and we need to make sure that happens. So the messages are, first, that the number of cases is high and increasing, so that is a risk and we need to be aware of it. Secondly, in order to try to reduce the chance of spreading infection, it's important that we stay cautious, we go very slowly with the opening up, and that people retain that distance and risk appetite not to go into places where you're going to have a high risk of infection, so that we try and keep the levels down. And third, that vaccination is crucial, and that the vaccination, of course, is crucial for all the age groups who are eligible, and it's important that we see the uptake in the younger age groups, as well as continued presence of giving vaccines to people who are older who haven't yet been vaccinated. Thank you, Prime Minister.